Welcome to Mr. Coco's Nurses class. So today I want to look at bed making, and then this type of a bed we want to make is called top to bottom. So top to bottom, we're going to perform while the patient is in bed. So we usually perform this kind of a procedure when a patient is on traction and they can't move out of bed. So I want to do this procedure so that you see how it can be done while the patient is in bed. But then the patient can be able to sit up. That's the beauty. They can sit, but they're on traction. So we'll be able to do this other part and the lower end, okay, or the foot end. We'll be able to do it while the patient is still in bed. So let's try to see what we can do. So what we do is we're going to, first of all, wash hands or use hand sanitizer. So I'm going to use hand sanitizer and also share with my assistant. Now this patient is not unconscious, so the patient is able to speak or say something. So good morning, Mr. Kamando. Good morning. Okay. So I'm student number 2 from Kalurushi College of Nursing. So I've come to do bed making. May I please go ahead? Okay. Is there anything I can do for you before I begin? Yes, said no. So let me check where you're sleeping. Okay, it's okay. So let me come back and do bed making. So I will be with my assistant. Would you please be my assistant? Okay, she has accepted. So I will be with my assistant Lillian so that we do the bed. Okay, so let's start. Okay, so what we do is since there is a patient, we have to wear gloves. Okay, so assistant should wear gloves, even you should wear gloves. Okay. So like that. Okay. So as usual, what we do when there's a patient, we do not expose the patient. We remove excess linen, which should be the counter pen and the blanket. So let's remove. So what we do, we just go like this. Okay. Then untuck. Okay. Then you can put on the chair, which we should be able to put. Then this side. So the blanket is out as well. So we have remained with a bed sheet. So you do not expose the client. So we'll be able to do the bed just like this. So Mr. Kamendo would like to remove the pillow. Okay, so we can remove the pillow. So at this moment, Mr. Kamendo would like you to sit up so that we can make the bed for you. So we'll start from this side, then end with that side. Is that okay? Yes, that is fine with him. So let's move on. Okay. So he will sit up. Okay, and then since you can move a little bit lower, you can move. Okay, so let us you can try to support his head. Okay, so I will start. Okay, so we'll do that. Okay. So Adrian, you can come inside so that you capture properly. Okay, so you'll be able to fold this other end as well as this other part here. Okay, so once you do that, you're going to get the blanket. So we're going to start the same way we do the foundation. That's how we're doing it. Okay, so blanket first. So I will tuck in my side so that even the assistant can also tuck in her side. Okay. Okay, so that's how we do it. So let me make a metered corner. Okay. Like that. So the patient can be moved this side so that we move properly. Okay. So we can just assume there's a traction there, which is pulling the leg. Okay. So I can still move this linen this way. Okay. And ensure that the linen is stretched to avoid pressure sores. Okay. So next is the bed sheet. So this is how we're going to do it. Okay, make a metered corner, then tuck in. Okay, stretch it. Then we should move on to the other parts, such as the counter pin. Okay, after we are done with everything here for the bottom shelf. So let's put the Macintosh. Okay. Once that is done, you can put a draw sheet. Okay, so you have to ensure that it's stretched, but we're going to stretch it as we finish. Okay, so like that. So meaning that this part of my side is done. So I'm going to also hold the patient so that the assistant can also tuck it. So can you hold the patient? Okay. You can also tuck it. Start with the blanket. Okay. Then the Macintosh and the draw sheet. Okay. Okay. So once that is done, Mr. Kamando, just lie down there. Okay. So Mr. Kamando is lying down like that. So what we're going to do is we're going to also remove this other part of the bed, okay? So the old linen is there, okay? So we're going to pull out the old linen, okay? Even the blanket, okay? We're going to remove that, okay? So, but don't expose the client. So then what you're going to do is we're going to pull the blanket. So let's pull the blanket. So we have put the blanket, then let's tuck it in. So blanket is tucked in. Then we've got the bed sheet. Let's pull bed sheet. Okay. So just pull so that it's tucked in nicely. Okay. Then we can now try to stretch the draw sheet so that this there are no wrinkles. You can try to put this side. Okay, so we need to prevent pressure source by pulling the linen. Okay. Okay. So at this moment now we have remained with the top bed sheet, which we have to remove. The same way we remove with side to side, that's the same way we're going to remove skillfully. Okay. So we're going to do this. So place the bed sheet on top of the odd one. Okay. Then you're going to pull the odd linen. Okay, just like that. You pull like this until it's out. Okay. So once it's out, we're going to now ensure that we tuck in. Okay. So let's tuck in and make a metered corner like that. Okay. Then we'll use now the blanket. Okay, so now let's make a metered corner again. Okay. Okay, so here we can fold now the blanket inwards or outwards. So let's try to do it inwards like that. Then we can use now count in here. So you can hold there. So let's tuck in and make a metered corner. Okay. There you go. Okay. Okay. So from there, you can stretch and then fold inwards. Then fold this bedsheet on top, like that. Lastly, I'm going to put a pillow slip to the pillow. So you put it inwards or inside out, like this. Okay, that's how you hold it. Then go there. Then the assistant will pull the pillow slip and then finish off. Since the entrance is this way, so the opening for the pillow slip will face the other way. Thank you very much, Mr. Kamondo, for allowing me to do this procedure. I was doing this procedure so that you're comfortable in bed. So that's how you thank the patient, and then you also go to the in charge that you have done the procedure, okay, and you have left the patient comfortable. So thank you very much for assisting my assistant. Okay, so keep watching and subscribe. Okay, so the last